So we can start.
Yes.
All right. Hello, everyone. Hope you all are doing well and safe, and welcome to this webinar. I'm Akansha Sahay, Project Manager at RehabPath India office. We are a Madison-based startup with the mission to help patients and families struggling with addiction and mental health issues. And currently, we have listed around 1,800 rehabilitation centers on our platform. And in today's webinar, we are going to talk about signs of alcohol dependency. And our guest speaker is Dr. Amar Shinde, who is the founder of Jagruti Rehabilitation Centre, and Rajnandini, who is a psychologist and is also working with us as a research associate. So basically, in today's webinar, we will talk in deep about signs of alcohol dependency. And this webinar will be a 1 hour session, and please feel free to drop your questions on our Zoom channel and on our Facebook page as well. Over to you, Rajnandini.
Thank you. Thank you for introducing and welcoming us, Akansha. Good evening, Dr. Shinde. Thank you for taking your time out to join us. So our topic for today is signs of alcohol dependency. So before we discuss about the topic, could you tell our audience a little bit about yourself?
Yes, I'm Dr. Amar Shinde. I'm a psychiatrist. I have experience of around 17-18 years. Since 2004, we are working. And we have started this Jagruti Rehabilitation Centre in 2008. It's almost around 13 years we are working in this field. So we deal with the psychiatry patient as well as de-addiction people also. And a lot of families and patients are satisfied with our treatment. So that is our plan. We have 3 centers currently. One center is in Pune, another is in Mumbai, and another center is in Delhi. It is in Noida, Delhi NCR. So we have a lot of capacity also, around 200 beds capacity at Pune, 200 bed at Mumbai, and 50 bed at Delhi. Yes, Rajnandini.
Okay, thank you. So you did tell us a little bit about Jagruti Rehab as well, but could you tell us a little more about how it was started and how your journey has been so far, and what are the different services provided in Jagruti Rehab?
Yes. After passing out psychiatry from BJ Medical College, I'm a student of BJ Medical College. Then I have joined the government mental hospital at Aroda. And after joining there, we have seen there is a lot of requirement of rehabilitation in these patients, for psychiatry patients especially. And because there was no very less quality centers. So we started working for the psychiatry patient. Along with that, there is also a lot of need of de-addiction centers. Very less centers who are very much equipped. Many centers don't have doctors, only they don't have medical treatment also sometimes. But addiction, if we see it should be treated as an illness. So that's why we started de-addiction center along with the psychiatry. Initially, we started as only 15 bed setup, and slowly it is grown. Currently, we are having more than 400 patients all over India. Also, along with that, there was also need for dementia care center, because the older patients who are having the psychological issues or any abnormal behavior, there were no centers, or sometimes these patients cannot be treated with the medications only. So we started dementia care center. It is one of the first dementia care center in Maharashtra, and slowly the care system in the dementia we have increased. A lot of care is there, a lot of staff is there. Also, we have started postgraduate psychiatry DPM program for MBBS student. It is equivalent to a DPM from university. So we are having currently 4 seats, so 8 students, 8 doctors are available. So we have round clock doctors, round clock nurses, round clock psychologists, and MSW staff. And also we are very fortunate, we are having very good dedicated staff. So that over a period of last 13 years, we have grown from 15 bed to 400 beds. So, and we are planning to launch much more because there is a lot of need in the society. Yes.
Okay, I think your journey has been amazing so far because you started with like a such small number of 15 beds in just a psychiatric facility. And now you've reached so far, and I hope that you go ahead and, have a bigger and, bigger and bigger goals that you achieve.
Thank you.
Uh, okay, coming to our topic of alcohol dependency, how common or how prevalent is this problem, like in your experience, as compared to other addictions? How common are alcohol problems?
Yes. Alcohol is one of the major addiction which is causing disability and medical illness in the patient. So a lot of patients uh, alcohol use, it is also termed as a like a social drinking. Okay? It is used in the parties. So many people use alcohol. So there are various categories we can divide alcoholism. Some people use alcohol once a week or once a month. They use in the small quantity, 2 peg, 3 peg. Then we can say it as a like a normal alcohol use. But some people have alcohol abuse and then alcohol dependence, then pathological intoxications, then alcohol with medical complications like liver dysfunction. So around the in USA there is a study around 10% of people are addicted to alcohol. So similar percentage must be here in India. Around 10% people of India are having alcohol use. In females in India, the use of alcohol is very less, I think. But in males, we can say it is around 10% who require treatment and rehabilitation.
So that's quite a prevalent number. I think it's one of the most common addictions within India
Yes.
itself, right? Okay. So talking about alcohol dependency, what is the approach that Jagruti uses in treating alcohol dependency?
Yes, for we have two types of treatment. Like some patients are on the OPD basis, and some patients on the rehabilitation who require high support system. So for this, we have different plans. Like one plan will be the medical plan, in which two-stage treatment is there. In which first will be the detoxification process, in which the withdrawal treatment is done, and in second phase, the anti-craving agents, anti-abuse agents, or the drugs which reduce the craving for alcohol is used. Along with that, we also have this psychosocial intervention in this patient because sometimes their alternative enjoyments, their have dimensions of life is disturbed. Alcohol is one of the major cause in which we can say all 5 dimensions of their life is disturbed. Like we divided life. Like first is the working. So sometimes the working is difficult due to alcoholism, frequent absenteeism, and that's why loss of jobs and financial losses. So this is the first thing. Along with that, familial dimension is disturbed. If we see the children of alcoholic people or wife or parents of alcoholic person, they are getting frustrated, depression. They sometimes get into depression. Also, they get into addictions again. So family dimension is also disturbed. We can say third dimension like physical, yeah, medical dimensions. They are having medical complications. They are having liver cirrhosis or sometimes accident, falls, injuries, aspiration, infections. These are more common in alcoholic people. Also social dimensions. Socially they are sometimes getting isolated. They go away from the drift away from the community, and a lot of stigma is there in the alcohol use also. So all dimension of life is almost disturbed due to alcoholism, and that we try to explain the people. We work on simple motivational interview. Sometimes people feel a lot of counseling and a lot of things are required, but simple motivational interview is also almost equivalent. There was one study in UK, simple motivational therapy versus heavy intervention. So on the motivational cycle we work. Like any person who is getting admitted on the first day, every person will have this pre-contemplation of stage of motivation. We call it as a pre-contemplation stage, in which they don't have any motivation, or they have a simple defense mechanism like denial. मैं कुछ दारू पीता गया, मैं कहाँ दारू पी रहा हूँ. A simple answer is there. यार मेरा quantity बहुत कम है, I don't use much. Then they blame other people, like थोड़ा टेंशन था इसलिए मैंने पिया. ठीक है. They give justification, they give reasons. मुझे loans है, I have a lot of loans, I have a lot of tensions. So this type of faulty thinking is there in their mind, and because of that they don't understand that alcohol is their problem. So in Jagruti, what happens after detoxification, we try to make them understand that all dimension of their life is getting disturbed, and that's why they should understand why alcohol, their use of alcohol is problematic, so that the person will come in the contemplation stage of motivation. In contemplation stage of motivation, people usually understand what they are going through, what are their problems, and what consequences because of the alcohol or any substance use. After that, the next stage will be the action phase, in which these people go away from the circle, because motivation cycle we call it as. They go away from the cycle, the tangential way, and we try to maintain them without alcoholism. We ask them to regular follow-up. Usually 1 to 2 years of treatment is required. And but alcohol is such a risky, or any substance is such a difficult to quit, that sometimes relapses are also common. So this is the last stage, and after relapse, so we try to teach them how to prevent relapse, how to avoid parties, and how to do the things in relapse prevention techniques. And after relapse, person again goes to the back to the pre-contemplation stage of motivation. This is a simple technique we use, and we have around 45 days program for alcohol de-addiction, so that their family, their work doesn't get hampered, and patients are also get stable. Yes.
I think you very beautifully explained in very much detail. So from what I understand, I feel like there are a lot of aspects of each person's life that get affected. So it's important to address each of them in different ways, like you said, social, work, home, family. Um, and I also really like how you said the last stage of treatment is also relapse. Because often people don't understand that relapse is like a part of the process and it's okay. It does not mean that their whole treatment has failed. Right? They have to go back to step one.
Yes.
So, all right. Okay. My next question is a more general one, not very much related to addiction. But as we all know, social drinking is becoming more and more popular now. So, with increasing number of people consuming alcohol, the question that arises is how much is too much?
Okay. So many people say that they are social drinker, or they don't drink much. But the natural criteria, if we see, the alcohol use should be less than 2 pegs per settings. And if a person drinks less than 2 times a week, that is called as a normal drinking. Means less than 2 pegs, only not more than twice a week. That is the ideal criteria for the people we can say they are having social drinker. Anything above 2 pegs, like 3 peg, 4 peg, they are having heavy drinkers. Yes.
Okay, that's a very brief answer. I'm sure a lot of people in our audience will introspect today and see. Okay, so coming back to alcohol dependency, what are the first signs that one can look out for?
Alcohol dependency can be divided into alcohol abuse, then pathological intoxication, binge drinking, and alcohol dependence. These are a few different criteria are there. Alcohol abuse means they are using alcohol excessively sometimes, but they are not dependent, like they are not using this alcohol daily. Like if they drink once in a month, but in excess quantity, and that is called as alcohol abuse. So these people may met with some accidents, may injure themselves. There may be problems with the calls, phones, or sometimes now the social media is there, so they can put some vulgar message or problematic messages on the WhatsApp groups and chats. Also, they can be little disinhibition is also there. So this is called as alcohol abuse. The second part is binge drinking. Binge drinking, usually it is called as a person if he drinks for 3 to 4 days continuously in the larger and heavy quantity, that is called as binge drinking. So these people don't drink daily. They don't require daily the alcohol. They don't have any withdrawal features. They can have a break of 15 days, 20 days, 1 month, 2 months, 6 months. But once they drink, they are having the heavy drinking, and sometimes because of that, their life is getting disturbed, their family is getting disturbed, their work, social, everything is getting disturbed, and after that they back to absolutely normal. Pathological intoxication is one part in which a person drinks heavily, or sometimes with a small amount also some people get more intoxicated, like their liver function is very, sometimes we can call it as the liver function is not working properly. So they are having pathological intoxication. They immediately drink and they get out, or frequent blackouts are there. And the last category is alcohol dependence syndrome. So in alcohol dependence syndrome, in which our body and mind both are dependent on alcohol, means without alcoholism you will not have, you cannot have your tea also in the morning. They can have withdrawal features. Okay, withdrawal features also. They are having tremors, trembling, loss of confidence if they don't use alcohol. Means first is the, if you have withdrawal feature, we can call it as a dependence. In withdrawal, usually there is tremors, sleep disturbances, hallucinations. These type of symptoms happen. Second thing is a tolerance. Tolerance means anybody, if he starts drinking early, usually he drinks a small amount. Within 1/4 or 2 peg, 3 peg, he will get the high. But as he drinks more, the requirement of alcohol is increased, so that the quantity of alcohol use will go on increasing. Like the person who drinks for 1/4 for 1 year, next year he will drink 2/4. Third year he will drink 3/4. That means that is called as tolerance. Third thing is, if alcohol is creating problem in your work, like absenteeism, loss of financial losses, misjudgments, like sometimes people do some online gaming or any other thing under intoxication, or any like selling, buying, also they can do under that, and they suffer a lot of losses after alcohol. So if you have this type of problem, then you can say, yeah, your alcohol is more. Fourth thing is, if you have any injury, accidents because of alcohol, then also we can call your alcohol use is more. And last thing is, because of alcohol, if you are socially disturbed, then also it is called as alcohol abuse, or alcohol, you need some treatment. And in simple way, we can say there is a cage criteria for CAGE. C means if you feel your alcohol is more and you want to cut down, then we can say your alcohol is more. A, then annoyed by others, means people are getting disturbed because of your alcohol use. G means if you have guilt about alcohol, and E means you are drinking in the morning, eye opener. This is the simple criteria. If one of the criteria is there, you have to look for the therapist or doctor. You have to come to them. You have to find solution about your alcohol use. Yes.
All right. So I think this circles back to how when you explained that alcohol affects all different aspects of your life. So I think that's where we can look for signs and see if these areas of my life are getting affected. And I think the cage criteria would be very helpful because I was just going to ask what should be the right time to seek help. Because even with other problems like I have a fever or I have a cold and there are some other problems, people tend to often delay it and say, it's going to be okay in 3 days, 4 days, 5 days, and don't seek help. So, when do you feel is the right time to seek help for alcohol problems?
Yeah, already we have discussed now. If you have this type of dependence features or cage criteria, one only criteria of the cage, if you fulfill, you require some help, or because of alcohol, if there is a family issue, disturbances, anger, then you need this. Yes.
Okay. So again, what can people who consume alcohol socially uh, do to keep their alcohol intake in check and drink responsibly?
Can you repeat the question?
Yeah, yeah. So people, like we discussed, that a lot of people consume alcohol socially nowadays. So for people like that, what can they do to keep their alcohol intake in check?
Okay, that is this cable. TV grade. So already I have discussed you, explained you, okay, to control your alcohol. When sometimes some people feel I can control my drink. So simple criteria: weekly, twice you can drink, but the quantity should be less than 2 pegs. So that is a less quantity. For this, you have to use some calendar techniques also. So whenever you drink, you have to mark and how much the quantity you have taken that day. So this is a calendar technique, and then you can come to know you are having how much alcohol. If it is more, then you have to stop it. So that is one technique you have to use. Then other techniques, many people feel you can alternate the alcohol with the soft drinks, like 1 peg of alcohol, then next peg will be of soft drink, again you third peg will be of alcohol, then the next peg will be of the cold drink. So that is the another way to reduce the quantity of alcohol use. Third way, you can shift from the hard liquor to beer. That is another way. Like the percentage in the whiskey or rum is more, so you can come down to the beer or breezer. That type of things are also advised those who want to cut down their drinking use. Also, avoiding the, you have to simply understand the relapse prevention technique. So you have to avoid going in the parties. You have to stop going out of the house in the evening. That type of some techniques you can use. And alternative enjoyment is the main issue. Sometimes what happens in alcohol use, the alternative enjoyments or hobbies are getting disturbed. So you have to develop something. You have to develop your hobbies. So that is another important part. Because what happens, even if you drink in the night, so you sleep after drinking. So that is also effect of alcohol. In the morning you will have hangover. That is also effect of alcohol. And in the evening you will have this happiness or little mood elevation because of alcohol. So a person who drinks in the night, usually he is indulged in the alcohol since 5 p.m. in the night to 11 a.m. in the day. So your working will be very limited. So you have to develop some things like hobbies, walking, exercises, gym, or many other things people do to avoid alcohol use. So healthy habits you have to understand and follow accordingly. Yes.
Yeah, those were some amazing tips. I think very practical and easy to use. Uh, Okay, you already elaborated a little on the difference between alcohol dependence, alcohol abuse, and other things. But could you tell us a little more what the difference is in terms of severity and in terms of treatments between alcohol abuse and alcohol dependency?
Okay. Usually the severity we cannot measure like that. I will give you a simple example. There were two brothers. The one brother was brought for the alcohol dependence because he was using too much alcohol. Almost every day alcohol use was there. Okay? So he was using alcohol. So the brother who was normal, who normal means he would use once a while or once a month or once in 2 months he used to drink. And the other brother was dependent. He was drinking every day. So the brother who was not drinking regularly brought him, admitted him for our. He was having also liver dysfunction and other things because of alcohol dependence. So he was admitted. After admission, around he was there because of the liver dysfunction. He was stayed there for 90 days. After that, he almost recovered. After that, the person who was having dependence pattern never used alcohol. But after 2 to 3 years, the brother who was dependent previously and now abstinent brought the other brother who was using alcohol once a while. But when I saw his condition, he was totally devastated because he drank one day and he fell down from his bike and he was having half paralysis and he was unable to talk also. So we cannot judge who is drinking more. Like alcohol abuse also, they get into this type of things like accident, fights, injuries, or sometimes there is a sudden deaths. Like if there is a program, young people person is there, and usually we can say in the Ganpati, in Mandal they used to people drink, and suddenly in the morning people think, people see one person is dead. So this is a routine thing. Means sometimes because of alcohol use, but uh, because of alcohol abuse is also very much problematic, and it is also getting much issue. And alcohol dependence, in alcohol dependence, there are two types of things happen. In alcohol dependence, what happens? They will undergo their liver problems, they are having kidney issues, they are having ascites and medical complications, high blood sugar, sudden heart attacks, sudden deaths, cardiac events. These are common with alcohol dependence. And for alcohol abuse people, the issue is different. They are having sudden deaths, like accidents, or sudden aspiration, vomiting, or convulsions, and many medical complications. So we cannot judge whether those people who say, I drink once in 6 months, but if he drinks heavily, then there is a problem. Yes.
Again, very well explained. This is giving me also a lot of knowledge about all of these things. Okay, so this part I think we haven't discussed it. What are the causes of alcohol dependency?
Okay. So usually, if we see causes, so causes we have observed a lot. First and foremost cause is the genetic reason. So many times the people who are having, we have seen the families in which father, their grandfather, grandfather, and everybody in the family drinks. So in this case, if there is a genetic predisposition, that is also very common. And if these people are exposure before 25 years of age, there is high chance that they will get into the addiction. So genetic factor is one of the important. Second factor will be the environmental factors, like in the schools, colleges. In nowadays, people do parties even in the school, 6th, 7th, 8th. They are having this. This is a normal culture now. They will go for party. If anything happens, they will go for the party. And in this party, if there is a exposure, then there is a problem. So sometimes in the parties or their colleagues or classmates, schools, friends, if anybody drinks the other person, there is a high chance that they drink. Third thing is the age of drinking. It is observed that why there is a note always below 25 people are not served alcohol in the hotels. Because if a person start drinking before 25 years of age, there is high chances that he can get into the dependence or abuse pattern. If the drinking age is more like after 25 years, after 30 years, the chances of getting dependence is very less. So we have to think for exposure. That is the first and foremost. Exposure for the children, it should be avoided. If it is early exposure, then there is a problem. Even the parents who drink in front of their children, there is very high chance that the children will start drinking alcohol. Many families and currently the marriages are like that. There is sangeet and everything. So many times alcohol is used, particularly in the north. It is like a routine social. But in this also the chances of alcoholism increases. These are the major reasons for alcohol. But according to patients what they say, I have tension, stresses, मुझे अफेयर ब्रेक हो गया इसलिए मैंने अल्कोहल चालू किया. So this is a normal explanation by them, but it is a way out for them. That's why they start drinking, but they don't understand that they are drinking for the dependence level. For dependence level, in my thinking, there is no reason, as the patient says. See, yes.
Okay. My next question is also like half covered in this answer. I was gonna ask, are some people more vulnerable to addiction than other people? So from what I understand, probably people who have had their fathers or grandfathers who were drinking, or things like that. But are there any other things that you think haven't been covered in the previous question?
Yes, genetic predisposition obviously there. If we expose 100 people, like 100, if 100 people are exposed to alcohol, young people like at the age of 18 or 19 years, not everybody will get into the dependence or abuse pattern. Many people initially use, some people say, I don't like the taste. Some people will start using only one peg, two peg, and only 10% of these people will start having heavy alcohol use, abuse, or binge pattern. Also, one of the reason for the binge pattern, we can say, whenever a person with the alcoholism is there in our setup, so we try to understand what is the exact reason. So sometimes there are other diseases also underlying the alcohol use. Even if a person drinks heavily, what are the reasons? So there may be sometimes some psychiatric problem, like a binge disorder. Binge alcoholism is always associated with bipolar mood disorder. So they are having mood dysfunction, sometimes high mood, sometimes low mood. So this is also common in binge pattern. So they drink in both poles, like whenever they high, they drink. Whenever they low, again they drink. So this type of pattern is observed in that. And if we treat such patient and they treat with the mood stabilizer or psychological treatment, then this patient get better and their binge drinking get less. Another part is anxiety. In anxiety also, sometimes any anxiety patient or obsession, OCD patient, if they start drinking heavily. So that is a problem, because alcohol is relevant. Sometimes some speaker use before 60 ml, 90 ml before talking, because it disinhibit you and your confidence and other thing increases, but it is very temporary. So these problems are, if a person is having severe anxiety, then there is a problem in severe anxiety. So and another illnesses like psychosis, schizophrenia, they are also sometimes vulnerable patient for alcoholism. Yes.
Okay, all right. So is like finding the cause or the triggers also an important part of the treatment planning?
Yes, obviously. Also, I forgot to note that personality issues are also common in alcohol use. Like cluster B personality, people are having more alcohol use, like antisocial personality or historic borderline personalities. These people are having much problem because of alcohol. So because they are dashing, binda, sometimes they drink for their people praise them. That's why they drink, or they are not worrying about anybody, or blame others. Or sometimes anger outbursts are there in the borderline personality. They can immediately anger. For the relievement, they can use alcohol use. So for these people, the triggers immediately there is emotional outburst, and immediately they can have alcohol. So we have to understand this problem, and we have to explain the patient. You are having this personality. You need some medications and need understanding of yourself. Yes.
Okay. All right. Yeah. So my next question is about trying to quit alcohol on their own. So a lot of people, when they realize or their family members tell them that you have been drinking a lot and this has been affecting all of us, and they suddenly stop drinking cold turkey. Is that a safe thing to do?
Yes, stopping alcohol, it should be sudden only, because many people, what happens, if they drink, they tell us, ki, I will reduce the dose. So they reduce for some days, 7, 8 days, 9 days, and again the alcohol use increases. So I would suggest ki immediate stopping of alcohol or any type of addiction is always advisable. But there is a lot of risk in this. This cold turkey or withdrawal features are very serious in some patients, particularly those drink every day. They are having heavy withdrawal symptoms. Simply, I divide the withdrawal symptoms in hourly basis. If a person suddenly stops alcohol, within 6 hours, he will have tremors. So hand tremors will be the first symptoms. Then after 12 to 24 hours, person will have sleepless night. They could not sleep in the night because of all his body and everything is dependent. After 24 hours to 72 hours, patient may have sometimes confusion, hallucinations, and they feel that somebody is coming to harm them. They see images of small people or chota animals. That type of feeling is there. That is called as hallucinations. The visual hallucinations are very common in the alcoholism. And at the 72 hours, some people may get convulsions. So sudden stopping without any treatment is always risky. If you stop suddenly and if you don't treat the patient, then patient will get in the withdrawal delirium also. They don't understand time, place, person. That is called as a delirium, and that is a more serious thing. So if you want to quit, if your alcohol, it is dependent on the alcohol use. The calculation of the dose of the medicines is dependent on the alcohol use. If person is having only alcohol abuse, he drinks once in a while, he will not get any withdrawal. But if person is dependent, so we have to calculate the doses of the drugs according to their alcohol use. If we understand, we know the alcohol doses, then we can use the medications properly. Fortunately, we have developed some plan dependent on the NHS UK guidelines for the alcohol use, and we are last 3 to 4 years we are not getting withdrawals itself. So that type of treatment we have perfect replacement of alcohol with the medications, and then that medications we slowly reduce.
Okay.
Yes.
That
So
sounds
then they
good.
require professional help. Some patients who are having heavy alcoholism, they should understand there is a high need of admission in the center. Yes.
Right. Okay. So it's probably best to get medical advice to see if it's safe
Absolutely.
to do something like that on their own. All right. This is my last question. After this, we can take guest questions. Is that okay?
Okay.
Yeah. What could happen if alcohol dependency is left untreated or if it isn't treated properly? Like a lot of times, people don't go to rehab centers and get proper treatment. They might just take medication or just go for group therapy. So, what happens if it's not treated properly or completely?
Yes, alcohol is a disease. So everybody should understand, and you can spread the message to the people. because many people feel that I drink on my own, I can stop on my own. So this is a routine thinking or routine talking. Even the relatives or even the friends feel ना उसके मन में आएगा तो छोड़ देगा. So this is a sometimes hopeless situation. So we have to understand कि alcohol is a disease and disease की तरह उसको treat करो तो ही अपने को result आएगा या alcohol quit होने का chances है. So why treatment is needed and what happens if you don't treat? If you don't treat, the simply the alcohol dependence person will have more and more medical issues. They have all changes in their body from their hairs to their legs. So sometimes hair loss is there, in the puffiness of the face is there. Then there is a chest problem, heart attacks, and other problems are there. Then abdominal problems like liver dysfunction is there. Then kidney dysfunction is there, ascites, bloody vomitings, then hematuria and other problems are very common. Even piles are there, their HB get down. So if you don't treat, the first thing is medically patient will get lot of problems. And this alcohol abusers or binge drinker people or pathological intoxication people, they can have injuries, complaints, reckless driving, accidents, head injuries. These are very much common. So one part is the physical part, that is most important. Second part, because of alcoholism, there will be a lot of absenteeism and ultimately work impairment is there. A lot of financial problems are there, financial misjudgments are there. So because of that, every alcoholism usually, if we treat, they don't have money because they lost everything in the alcohol use. So financial problems are very common in the alcohol use. Third problem will be the effect on the family. The family people are getting depressed, the children are getting depressed, their wife is sometimes battered, she may also have severe depressions, parents and all families getting involved. They can hamper the performance in the colleges, schools of the children. Also, they can start drinking early. That's why many problem happens in the family. Fourth thing will be the social impact. There will be a lot of social impact. The value of the person in the society will go down, and person may get frustrated because of that. Also, the reputation in the society also will go down. And lastly, sometimes some people with alcoholism may have some psychological effect also, like mental problem, mental health issues, depression, anxiety, psychosis. These multiple problems they can have. So that's why we have to treat early. We have to look for the treatment. We have to find ways for the treatment of such patients. Yes. So alcohol is a disease, and you need treatment for that.
All right, okay. All of the symptoms sounded very, very serious. So I hope the session helps people and people reach out and take help when they need. Okay, let's look at the guest questions. Okay. There's one question asking, though you want to control your drinking habits, but when your friends force you to drink, it provokes you to drink. What should one do in this situation?
Yes, that's relapse prevention techniques are there. So this is one thing that is called as relapse prevention, and this is the most commonest relapse. Even if some people have confidence, my friends are drinking, I will go there, I will not drink. So if you have alcohol around, 1 or 2 times, 3 times parties, you cannot say no, but ultimately you will use that alcohol. So in this case, I would advise you should avoid such parties. You should avoid such friends also sometimes, because two friends come together who both are drinking, they both increase each other's problem. So sometimes you can meet such friend in the morning. बोलते हैं ना सुबह के friends बनाओ. So उसी friend को you can call. He will come in the morning. We'll go for the trek, or we can have some exercises and some light like cold drinks, etc. You can use soft drinks also sometimes. So you have to think, you have to decide what is your problem. because sometimes many other people are not having much drinking problem and you are having the problem. That's why you should avoid such situation where it can be relapsed. Yes.
Okay. All right. There's another question that says, does alcohol make you stubborn? I have seen people not accepting their mistakes when they start drinking, and once they stop drinking, their mind starts working in a better way. They become more responsible. Does this happen?
Yes, after stopping, absolutely, a person will improve and their mental condition improves, because while you are intoxicated, there is also a fear, anxiety, guilt. That type of symptoms are there. The concentration in the work is also reduced. The responsibility also gone down. That's why if a person stop drinking, they will get more responsible and they will work more for the society, their family, and their self. Yes.
Okay. There's a really nice question here, which I also have now. Is it okay if I drink moderate quantity every other day without harming my health or personal life?
I have told you the less quantity or normal quantity means twice a week, less than twice a week. The maximum will be twice a week and less than 2 pegs at a time. So that should be the quantity that is not harmful at all. So that we have to decide, not alternate day, twice a week only.
Right. Uh, okay. How to make a person believe that he or she needs treatment and is an addict?
What I'm not getting?
How to make a person believe that he or she needs treatment and is an addict? Like you said, they often have denial. So how do you convince them of treatment?
Yes, that is called as pre-contemplation stage of motivation. That means there are certain defenses like denial, justification, reasoning. That is in the beginning, or minimization. These are four important used by people. Or blaming, fifth will be. Means denial means they don't accept they are having problem. They don't accept they are using alcohol excessively. They are having complications because of that. They can minimize. छोटा प्रॉब्लम है, आई हैव प्रॉब्लम बट मेरा प्रॉब्लम इतना बड़ा नहीं, मेरा प्रॉब्लम खूब बहुत छोटा है. और रीजन बिकॉज ऑफ दैट आई एम ड्रिंकिंग, ब्लेमिंग वाइफ, उसने ऐसा किया इसलिए मैंने ऐसा किया. तो इस तरह से सिम्टम्स रहते हैं. तो इसलिए प्री कंटेम्पलेशन से कंटेम्पलेशन फेज में जाने के लिए हम कोशिश करते हैं. ये जो तो उनके फॉल्टी थिंकिंग है, दैट वी हैव टू इम्प्रूव so that the person should understand all dimension of life is getting affected by the alcohol. That you have to explain. Like 5 dimension we can say. Physical dimension means medical complication. Second will be the psychological dimension, in which concentration, depression, anxiety, psychosis is there. Third is a family dimension. Fourth is a financial dimension and psychological dimension. So these all dimensions of their life is getting disturbed, that we have to tell them repeatedly. Sometimes we get frustrated why these people are not listening, but you have to keep doing it, and ultimately the result comes. We should wait for the day in which the person himself decides, I have problem and I should take treatment. Yes.
Okay, great answer. Let's another. Okay, do we have body pain because of drug or alcohol intake?
Yes. Before, if you have craving, like what happens sometimes, if people say I have a lot of body ache, that's why I drink. Okay. But why this body ache? Body ache is because of alcohol use. If a person drinks every day, in the evening he will start having body pain. Okay, he will having weakness. But suddenly, once the glass is on the table, patient get relieved. Their body get relieved immediately. So that is a problem with the alcohol. So body pains, abdominal pains, these are very common in these patients. Yeah. And sometimes neurological issues happens afterwards also, like they are having burning in legs, and sometimes difficulty in balance or drunken gait without alcohol use. So that type of neurological symptoms are also common in this issue. Yes.
Okay. There's another question. Why does alcohol affect me differently from my friends?
Yes, you have to calculate okay, how much alcohol use is affecting yourself, and our criteria, the lower limit of alcohol you should understand. Then sometimes you may feel okay, I should cut down. There is always guilt in the mind. So that guilt is important, and that make a person depressed or frustrated sometimes. But after a few days, again the guilt goes, and again the same pattern follows, and again the guilt is there. So
Yeah.
you need to understand okay, how much quantity of alcohol is required for you, and how much you should use. If it is getting problem, or it is getting psychological issues or depression, anxiety, then you need to cut down it absolutely. Yes.
Okay. All right. There's a question that I have. Very often, people with alcohol addiction might be the only bread earners in the family. So, if it's not feasible for them to like
Admit.
quit, yeah, their work and get admitted for several months at a stretch, what should they do?
Okay. That's why we have made this 45 days program. It is not too much, because usually 10 to 15 days treatment is required for the withdrawal and general weakness they have to recover. And after that, 30 days of counseling and other counseling techniques like sharings, meeting, this type of things are there. So we have made this 45 days program. So 45 days program, I don't think that much leave they don't get. But these people, again, the same thing, because they are not understanding alcohol is more problem. That's why they try to give us always, they will try to give us reasons, I'm busy, I'm working, I'm the sole owner. Okay,
Yeah.
this type of things happen, and because of their alcohol use, their everything is getting disturbed, their finances are getting disturbed, and if they don't take treatment regularly, the situation will be worse from than this. Yes.
Okay. All right. I think it's almost time. So, can we take one last question?
Yes.
Okay. Okay. Does the type of alcohol affect the severity of addiction? Like something with a lower alcohol content, like wine, is that better than something with a higher alcohol content, like vodka or whiskey?
Yes, it is advisable that those who are having problems with the heavy alcohol use, like intoxication and severe withdrawals and other things. So in that case, we are advised you should have softer drink like beer, wine. They can use, because the percentage of alcohol is higher in whiskey and rum. It is around 40-45%. So sometimes they suddenly get out, or sometimes pathological things happen in this patient. It is always advised you should use the alcohol with the less percentage. But even though sometimes the people start drinking more of that quantity,
Yeah.
and again they come to the same level. The alcohol of any things, you have to calculate the doses, as I already said, twice a week and less than two peaks at a time. Yes.
Okay. All right. I guess that's it. So it was a very, very informative session. I'll hand this over to Akansha now.
Thank you so much, Rajnandini. Thank you so much, Dr. Shinde and Rajnandini, for such an insightful session. I'm sure the session will help a lot of people. And we had the details were so accurate and so much in deep, and the questions were also really great. So thank you so much once again, both of you, for such an insightful session. So before we conclude, Dr. Shinde, do you have any message for the audience as a psychiatrist?
Yes, always everybody in the audience, they should understand that there are people around you, they are your friends, your family members, and you have to always look for the alcohol use or any type of addictions, because it is very much increasing nowadays. So, like the first thing is the prevention. So, if a young person is drinking or there are parties, you should advise them you should drink after 25 years of age. So, there are very less chances of alcohol use after that. So, you can always ask them not to use alcohol or any type of addiction in that parties. Also, if a person is having more drink or getting pathologically intoxicated or problems, so you need to always tell them ki you need some treatment. Sometimes treatment is very simple. Sometimes we can give on the OPD basis itself. So it is not necessary means rehabilitation or addiction treatment is admission. It is not like that. We can treat them on the OPD basis also. They can join the AA groups, NA groups are there for the alcohol and narcotic addictions. So you have to work on it. The first day when you decide I should work on my alcohol use, that is the success. If a person feels he start working on that, slowly his quantity and other things 100% goes down. So you and people around should be aware about the alcohol, and alcohol is a disease that you have to understand. Right? So sometimes people tell, he is drinking intentionally. It is not like that. It is a disease and we have to treat it. That is the main thing. Yes, thank you.
Thank you so much, Dr. Shinde, for the wonderful message. And once again, thank you both of you for the great session today. And thank you to our audience also for the participation and for attending the webinar. And we will be back with another webinar soon. Till then, please stay safe and have a great week ahead. Thank you, everyone.
Yes, bye-bye.
Bye. Thank you.
Thank you. Bye.